Welcome to another edition of the Natural House Call with Dr. Z. You can always get in contact with me by going to my email, which is drznaturally@gmail.com. Or if you've read a good book or have a good guest uh, or interesting person that you want me to interview, yeah, send me an email. That'd be a great idea. So, without further ado, we're going to do a deep dive today into cardiac disease, all things revolving around the cardiovascular system, with our expert, Dr. Lisa Gengo, who's a friend of mine for a very long time. Dr. Gengo was one of my students at the College of Naturopathic Medicine in Bridgeport, and now has more than 30 years of clinical experience in caring for patients. Now, she started out by becoming a cardiac surgery physician's associate, then quickly became Chief of Physicians Associate at New York Presbyterian's Weill Cornell Medical Center only 6 months after graduating from PA school. While operating on cardiac patients, Dr. Gengo realized that most cardiac diseases started years prior to the patient being in the OR, and she decided to really heal patients, care needed to start decades sooner. It was then that she learned of naturopathic medicine at University of Bridgeport, a program that I helped start in 1994-5, that time frame. And she enrolled and she graduated with her Doctor of Naturopathic Medicine degree. And then she heard about functional medicine and became certified and went on to teach other medical professionals in functional medicine as the Institute for Functional Medicine, with an undergraduate degree in toxicology and experience in functional and naturopathic medicine, both investigative fields. Dr. Gengo looks to uncover the answers to get to the root cause. We practice root cause medicine, known as the health detective. That's funny because I always say that I'm a blend of Columbo and Monk. She has a successful practice in Stamford, Connecticut, specializing in cardiovascular disease and metabolic syndromes like diabetes, autoimmune disorders, adrenal hormone, and gut digestive disorders. Can I call you Lisa?
Absolutely. Don't call me anything else.
I like that. That's a funny joke. Welcome to this edition of the Natural House Call.
Thank you for
So
having me.
yeah, you're welcome. It's a pleasure to have our, graduates and now colleagues of mine on. I know you even went on my Jamaica trip
Oh my
to
God,
study.
yes, I want to go again.
Yeah, that would be great to study with the Maroons and the late Jamba of the Maroons. We go in March, um, and study ethnobotany of Jamaica. So that's sort of coming up, hopefully. And but now I have a question here. We're going to zoom in and talk about heart disease.
Okay.
Now, as both a PA and a naturopathic physician and functional medicine doctor, you're walking a tightrope between the conventional medical model and what they say about cholesterol, like it's a dirty word,
Yes.
and what we really know about the physiology, what every doctor should know about cholesterol, that it's in every cell,
Yes, it
helps you
is.
make sexual hormones.
Yes, it is.
How in the world can it be bad?
Well, it's not. That's the point. And it's very frustrating because even in the what I'll call traditional regular medicine, even in their research, this is all they know this, but it's been forgotten. And we've been hijacked by this whole idea of cholesterol being bad. And I think what they do is they try to they being the universal they, try to streamline things or make it very linear. And as you said, cholesterol is in every cell. It what keeps our membranes fluid. It's what keeps us healthy and young. It helps us with our stress. It helps with vitamins and everything else. And they say there's good and bad cholesterol. Well, no, there's not. Cholesterol is healthy. I always say to my patients, nature or God or whatever you believe in, the higher power, didn't make cholesterol for it to be bad. Okay.
Mm,
It's
mm.
useful
Nice,
and
interesting.
useful for a lot of things. You would want, you know, you would want your cholesterol. You wouldn't want to.
Yeah, so here's that whole medical model, and I wrote an article with the Natural Nurse, which was called "The Cholesterol Myth," which I think is the
Yes,
name of actual book too.
it is. It
Um,
is.
And so the idea is that, cholesterol is used to make testosterone, for instance. Guys like
Yes.
me, right? We met women too need testosterone too.
Yeah.
Estrogen,
Yes.
progesterone,
All the
adrenal
sex hormones.
hormones,
Yes. All the
brain stuff, right?
Yes. Well, you would think about our brain is composed mostly of fat, which is cholesterol. So we need it. And you'll see a lot of times little kids, I know my nephew would eat like butter, like he'd eat a stick of butter, and my everybody freak out. But when
Mm.
you're young, your brain is developing and you need fat. And there's also been some cases of people who have severely restricted fat from their children, and they wound up having, neurologic disorders. So fat is and cholesterol is very good. It can be bad
Mm.
for you, but that's when it's disordered, or what I call rusty cholesterol is not good. Regular
Rusty
cholesterol,
cholesterol. I love that.
yeah,
So,
that
so
would
why
be,
did they say that? Why did they come up with this idea that there's bad and good cholesterol if that wasn't what the creator had in mind? I love that saying. That's great.
yeah. Um, well, the thing is that there are different cholesterol particles. Okay, the ones that are most common are the LDL, low density lipoprotein, or the HDL, high density lipoprotein. There are other ones too, but we'll focus on those for now. So, low density lipoprotein, or LDL, is a cholesterol particle that basically is made in the liver, and it's kind of like it's sent out in the bloodstream to patch up little holes, to repair our membranes and our vessels and our cells, that kind of thing. So it goes from the liver out to the rest of the body. Now, the HDL is like the dump truck. That's the lipoprotein particle that's out in the body searching, finding cholesterol that has to be taken back to the liver to dump it out and just,
Mm.
repair it, destroy it, whatever.
Hmm.
So that's how, so the linear, or the thinking is, well, if it's going out to the tissues and to your vessels, then that's bad. So that's why they label the LDL as the bad cholesterol, because that's the cholesterol that's going to go out to your heart or your brain or your small vessels and cause problems. The HDL, they say, is good because that's picking it up and taking it back to the liver to be reprocessed. So that's how the good and bad came upon. Now, the thing is that LDL can get oxidized, okay? But HDL can too. So the thing is there, I tell my patients all the time, there's no good and bad cholesterol. They both can be good and they both can be bad. Okay.
Yeah.
So, what I would term as good cholesterol, we want big, fluffy particles. Okay. So, when they're big and fluffy, they don't stick to the walls, they don't cause problems. When they're small and dense, they can get into the arterial walls, they can get in and cause problems when they are oxidized.
Yeah, so what is oxidation for people? You mentioned rust before, which I think is a
Yeah.
great analogy.
Yeah.
Expand
So,
on that.
yeah. So, oxidation is basically when you see something rusting, that's oxidation. When your apple used to turn brown, because a lot of them don't turn brown anymore, when you would cut it open and it would turn brown if you left it out, that's called oxidation. So that's where I don't know, how do we explain this without getting too
Well, I
uh
think it's like oxygen. I know oxygen kind of attacks
yeah,
it and
yeah.
makes it unstable, I guess is a
And
good
and
way
it
to
and it changes it. So it
causes a free
starts.
radical to be made, right?
Yes, exactly, exactly.
Hmm.
So that's what you don't want.
Hmm. So then, what is the actual real cause of heart disease? I understand it as sort of like if LDL is the guy from one of these department stores bringing the spackle over to the house to fix a crack in your ceiling. I'm using the analogy that you have cracks in your arteries.
Yes.
Then why mug the guy? Why mug the spackle guy or kill him or get rid of him if he's coming? He's the fireman coming to the fire or the policeman coming to the scene of the crime, like Spider-Man used to do, right? He would always be at this
Yeah.
come to the scene of the crime. Why beat up Spider-Man? And that's what allopathic medicine is doing, right?
Well, I think our focus is misguided. Okay. So you kind of mentioned it just in your analogies,
Uh-huh.
putting out a fire. Okay. All chronic diseases, in my opinion, come from inflammation. Okay. So we sprain our ankle, we swell up and we get red and we have pain, and that's what we call inflammation. And it is. But there's also systemic or underlying inflammation that you may not see. Why do they associate flossing your teeth, which I think using a water pick is better than flossing, but anyway,
Mhm.
we'll get that's a sidetrack. Flossing your teeth helps protect heart disease because if you don't water pick or floss, you have microbiota in your teeth, in your mouth, that and you get gingivitis. That's an underlying inflammation that's happening. But many things can cause that. Drinking too much stress. This under our the way the Americans live their lives is a stressful event, okay? And it causes the food we eat is the big one. And so I would say that the real cause of heart disease is underlying inflammation. It could be toxicity. It's so where it comes from. So I'm using inflammation as a broad term, but
Mhm.
but I can have five people with heart disease. They didn't all get there the same way. They don't have all the same inflammatory insults. Some of them might be common, but that's where the detective work comes in. When you're sitting in front of me, I find out what your life has been like, where you've come from, how you eat, how you sleep, what you do, to find out, to dig underneath, and where are your root causes of your inflammation.
And that, like you said, it could be every from the way you think to
Yes,
the oils you're eating
yes,
to or you're lacking antioxidants or you're not taking enough antioxidants in the body or you're not making antioxidants. Let's talk about that. That's kind of really interesting. Some of the holistic markers that I assess people for a good cardiac workup, I'll throw one out there that we can kind of pull apart, and
okay.
that's called homocysteine, which I read an article that said that homocysteine will be the next cholesterol.
Mm.
And I think doctors are catching on that if homocysteine goes up very high, that causes heart disease. And I know that that's connected to a genetic thing, which they
It
call
can be, it can
MTHFR
be.
mutation, and it
Yes.
has to do with B vitamins. So maybe simplify it for patients. What's the homocysteine and methylation thing all
Okay.
about?
So, okay, so methylation. So homocysteine is a byproduct of methylation. And some of us genetically methylate well, and some of us don't. In fact, 60% of the population will have disordered or genetic SNP, what they call a genetic code, that we have disordered methylation of some sort. So the most common one is MTHFR. It's a very long word that I'm not going to try to pronounce.
That's
Now, you
okay.
could
Yeah.
take a stab at it if you want, but that is a SNP. And if you have, like, there's two different genes, and you can get tested for. It's just a swab, and you can find out if you do. So, what does it mean? Well, it will tell you whether you methylate well or not and how well you do. So what does that mean? It means that you don't process, one of the things is you don't process B vitamins in the same way.
Mm.
So now a lot of the supplements will carry methylated B vitamins instead of just it'll be in the methylated form to help people. But it also means like you might need other things. You may need more B vitamins than the quote normal person. You might need trimethylglycine. You might need different things to bring that homocysteine down.
And the main thing is you can't get the B vitamins from your food or
Yes.
cheapo vitamins that you get at the drugstore
Yeah.
because you can't use B6. You have to use pyridoxine 5 phosphate, which is the activated or
Yeah.
methylated form. I guess a methyl group is carbon and hydrogens that the body
Yeah.
puts on something to make
Yeah.
it useful.
Yeah. So I find people need more, and even within my practice, I might give a certain supplement and it will work for most people, but some people need a little different formulation. So you kind of have to test it out and keep repeating the test to see if it goes well. And homocysteine, yes, for cardiac disease, but it's all vascular disease. You have an increased risk of stroke. You when you have MTHFR def, SNPs or deficiencies that you're prone to having miscarriages. So when
Mm,
I hear somebody, because sometimes like the insurances won't cover the testing, but if I hear a history of having a lot of miscarriages or a predominance of stroke or cardiac disease in their families, I'm pretty sure that they'll probably have MTHFR. There are other ones. There's one called COMT. So there's different ones,
mm.
but MTHFR is the most common as far as genetic SNPs.
I know one of the ramifications of having the high homocysteine is you can't make this thing called SAMe, which is, again is you're adding groups to an amino acid called methionine, and that has all ramifications with mental health and using your
Yes,
neurotransmitters and things like that. And you can't make the most important antioxidant in the world in your body.
glutathione.
Yeah, because some antioxidants you need to get in your diet all the time, and some your body makes. And I always think, wow, this medicatrix naturae, the healing power of nature, one of our naturopathic mottos. I said, if the body spends a lot of time making something, it's got to be super duper important.
Exactly. Exactly.
So so the ramifications of the homocysteine would be you don't have enough glutathione.
Yes.
What are some of the problems with that?
Oh my God, you name it. You can't detox,
Yeah,
okay?
exactly.
Or it's hard for you to detox. Um, you're probably deficient in a lot of things like vitamin C and things like that. Um, and you can't get rid of the byproducts of just normal living, just with what our body does.
Hmm.
So it's not a good thing.
Yeah. And if oxidation has a lot to do with
Yes.
the ox LDL, then that would be something I would say that both you and I would fix up in the patient right away.
Yeah, yeah, yeah. So, it's funny because people won't think of this, but a lot of a lot of what happens as far as our cholesterol has to do with the liver. But we don't usually think, oh, the liver is part of the gut. Okay. So the most common, I'm sure, the most common things I get in my office are gut problems.
Hmm.
Okay.
Hmm.
So, and as we were taught by you fix the gut first. Okay. Every good naturopath or functional doc has to fix the gut first before you do anything else. So, optimizing liver function, okay, and gut function is the first thing to do. And sometimes just that alone will help correct the cholesterol. Okay. So I see cholesterol being disordered in whatever way as the red flag. I don't see it as the cause. It's the red flag that there's something wrong. Is it inflammatory because of your gut, which a lot of it is? Is it inflammatory because your hormones are off? Okay. So, yes, you could give glutathione and you can help, but to me, it's like getting that whole gut together and working appropriately first, and then seeing what you're left over with.
Yeah, I mean, if the bacteria in your gut are off, they actually produce this toxin, which the old timers always talked about. They called it, bowel toxemia. I'm
Yeah.
remembering my old readings from back in Best when I was at Bastyr. But now we call it lipo LPS,
Yes.
lipopolysaccharide, which triggers the toll-like receptors, which are like little tolls in
Y-
your gut, and the drawbridge opens, and all the poisons get in the bloodstream. So
Yeah.
it's like we we've known this since Ayurvedic times because the Ayurvedic doctors always talked about that the the gut is the source of all most diseases. But now we're just finding the science to describe these ancient concepts.
Absolutely. Absolutely. I like to simplify things because, yes, we could talk the LPS, and it's great to find out that they were right and that what we practice actually, there's a reason behind it medically,
Mhm.
like something that they could study, that kind of thing. But I always tell my patients, medicine is 99% common sense. Okay. So, and even for practitioners, if something is really confusing, get back to basics. Okay. And just and the gut being one of them. They're actually trying to isolate different microbiota that help with heart health.
Wow.
Don't ask me what they are because I don't know right now, but I
Yeah,
know
no,
that,
it's in
that's
its
something.
infancy. Same thing
Yes.
with, rheumatoid arthritis, which I, have done a lot of work with and things like that. Yeah.
Yeah. Yeah.
So you definitely want some of these holistic markers assessed. What about the thickness of people's blood? Sometimes, they wake up and it's like the oil on a January day in your car. It's like thick as molasses. So you have, I call it maple syrup blood.
Okay. So are you talking about fibrinogen or
Yeah.
glycation? Okay.
Actually, both. Why don't you talk about both? Those are very interesting because I think, when we look at hypertension, for instance, like why is people's pressure high? That's a big heart disease that almost everyone coming in here, we check their
Yeah.
pressure and do their vitals. And we look at, different parameters. Now, a lot of times the doctors, they'll just give you a medication to lower the pressure, but they're not investigating why the pressure's high in the first place.
Oh, they never do. And they're supposed to. Even in the Merck manual, it says that. Okay.
Yeah, right. So tell us
So,
about glycation and fibrinogen.
okay. So, first, just before I forget,
Mhm.
when somebody's hypertensive, first thing I have them do is find out their hydration status. A
Oh,
lot of people, because when you get older, you lose muscle. When you lose muscle, you can't hold on to water and
oh,
you need more water. So you have to make sure your patient is well hydrated. I know personally, I even have a hard time hydrating because I don't like drinking water. But you can normalize. I have seen so many patients when they've coming into the hospital and we just give them some IV fluids, their pressure normalizes. But
wow.
anyway, that's an aside.
No, I
Okay.
think that's huge because that's a danger. Dehydration is now what they call a danger signal from the body that
Yeah.
releases all these, heat shock protein and all these alarm hormones, which catecholamines, which I guess is adrenaline.
Yeah.
So it's an alarm when you're dehydrated. That's great. And there you go, drinking water. Fantastic.
I'm
I
actually
have a cup of
drinking,
tea because
actually
in the
for
winter,
hypertension,
yeah,
hibiscus tea.
hibiscus. We'll talk
Yeah.
about what to do later, but I like, in the winter time,
Yeah.
I like warm things versus cold, being, looking at the seasons and you can encourage patients to do that. If they hate cold water and it's winter time and it makes them frozen, sip on tea. When
Yeah.
I went to an Ayurvedic clinic once, that's what the doctor did. He goes, "You need to sip on tea." Dr. Z all day. So for the whole panchakarma, clean out your body
Yes,
thing, I
yes,
sip
yes.
tea all day. It was just
Yeah.
really
As long as you don't put a lot of sugar or milk or stuff in that, like,
right.
herbal teas are best. I mean, because black tea can be a little diuretic, but I tend to, the whole thing, half your body weight in ounces. Don't do it all in one day. Slowly increase because you'll be up all night. But yes. So let's get back to fibrinogen.
Sure.
So again, fibrinogen is made in the liver. Okay, here another gut connection.
Mm.
Okay, and it's basically an inflammatory protein that we make. And so a lot of times for testing purposes, how sticky is your blood? Okay, so there's several. Fibrinogen is one that you can do. Hemoglobin A1C is the glycation of the red blood cell. So I always say it's like caramelizing onions, or you caramelize something in a pan. That's like you create the advanced glycation proteins or ages
Yes.
and
Ages. It's the
products.
ages.
Yeah.
It's the ages that age you
Yeah,
is an
exactly,
old
exactly.
naturopathic aphorism.
So it's like the sugar glycation is like sugaring something, or the actual thing is the ages, the advanced glycation end products, and that modifies tissue. And as far as with the heart, it can lead to congestive heart failure. It also causes inflammation, increases your cholesterol, and it causes cell death. So this is something that, okay, those are really very two things that you can test for. Sometimes just hearing their history, you're going to know that that's probably, true. Okay. Um, the next one, it's not for for the thickness of blood, but another inflammatory protein would be the high sensitivity CRP. Okay. So that one will, the high sensitivity one is another, these are both the fibrinogen and the high sensitivity CRP are acute phase inflammation, not chronic inflammation. They will go up with chronic, but the high sensitivity CRP or C-reactive protein detects low levels of inflammation.
Huh.
Okay. And that's especially useful for the vasculature. So people think, oh, it's for the heart. But I always say any small blood vessel, no matter where it is, it's not like they only know to go to the heart. It's in your brain, it's in the extremities, in your toes, that kind of thing. So those are really good things to test for. Um, there are other, I'm trying to think if there's other
Ferritin. I heard that ferritin, which
yeah.
we work with, we think is iron related, but it's also an inflammatory protein. And I guess you could check if you wanted to spend a lot of money, you could check your interleukins and interferons and
Yeah,
things
yeah.
like that. But usually we don't do that. We just look at
Yeah, I
those
don't
other
usually do the
parameters.
ILs.
Now, with
Yeah.
high blood pressure, what about your output of adrenaline and your adrenals? Because that plays a role. If you're constantly under stress and you're pumping out epinephrine, which is used to be called adrenaline, now they call it epinephrine, that's going to cause constriction of your vessels, right? And jack up your pressure.
Yes, yes.
Hmm.
It will do that in the short term. Okay. Now they studied race car drivers and they tested their cholesterols. And when they were strike, because it's a stress when you're going 200 miles an hour around a track amongst all these, it's a stressful event. And their cholesterols go up. So for me, the chronic stress that we're under, there's a lot of things. It makes your blood pressure go up for sure, but it also increases your cholesterol. Now, you, I always explain this as, okay, in the old times, you had your sympathetic nervous system. Well, we still have sympathetic nervous system, but the fight or flight, you're running away from the saber-toothed tiger, okay? And we need cortisol for that. Okay. So you have the base molecule of is cholesterol. Then you have all those pathways that go down to our sex hormones, which we'll get into in a minute.
Yeah.
In the middle somewhere is cortisol. Okay. So if you are living a lifestyle where you're in fight or flight, like, you're outputting cholesterol, cortisol. Okay. Your cholesterol will go up because now you're getting the cortisol steal to make that for your stressful event, your stressful life. And you're not making enough sex hormones because not enough, it's the cortisol steal, not enough of it is getting down to make your sex hormones. So your cholesterol you start pumping out. Your body's very wise. It wants to pump out more cholesterol for the needs to make all the hormones that you need.
You're listening to WPKM Bridgeport 89.5 FM, listener-sponsored free speech alternative radio. And this is the Natural House Call with Dr. Z and our guest, Dr. Lisa Gengo. And yeah, we can get back before we take our break. With this chronic fight or flight response, it's like you mentioned, it's like robbing from Peter to pay Paul. You're robbing, whereas your body would, so you need the adrenaline to fight
Yeah.
the saber-tooth tiger or the bill collector or these,
Or
whatever
just the way
natural
we live life
catastrophe is
here.
happening, right? And so thus, of course, your body's going to make cholesterol. If cholesterol is the building block of the adrenal of cortisol, it's not the building block of adrenaline. That's the amino
Yeah.
acid tyrosine, but still.
Yeah.
Um, it makes sense that the cholesterol would be elevated. So does the doctor, when they see a total cholesterol high, ask any of these questions? Usually they're just like, "Oh no, you need
No.
a statin." It's like,
Yeah.
"No, you don't. You need to take a vacation.
Yeah.
You need to go to
Exactly.
Jamaica.
Yeah.
That's what you
Exactly. With
need."
Dr. Z. No, 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 we don't have a statin deficiency. That's not what, you know what
Wow,
I
I
mean?
like that. So in other words, high cholesterol is not a statin deficiency.
Yeah, exactly. So high cholesterol is the red flag. Again, it's signaling to me something's wrong. Either the liver's not happy, your inflammation is going, or you're too stressed out, or all three. It could be, any of that.
Yeah, well,
So,
your hormones are low. Like I'm thinking guys going through andropause or
yes,
women going through menopause, that's a change. It could be
yes,
stressful, and the body's going to need more if your testosterone's dwindling. How do you make testosterone? Cholesterol.
exactly. So many women, and I have a program specifically for women
Oh,
and for cholesterol. They're addressing the heart risk factors when they're perimenopausal or menopausal. And I'm my own avatar. I always had a very low cholesterol, almost too low, 140, 150 total cholesterol, right? As
mm-hmm.
soon as I hit menopause, went up to 240. Never in my life. Okay.
Right. And you didn't
So
change your diet, or
I didn't change my
you're not
diet. I
eating.
did. Okay. I was stressed, but and very quick fixes that have nothing to do with statins. Now, getting back to when I test, the testing I do, to me, the regular tests that the doctors do, total HDL, LDL, they mean nothing to me.
It's like Mickey Mouse,
Yeah.
or I call it Leave It to Beaver medicine. It like
Yeah.
went out with the beaver.
Yeah. I do particle size. I do a complete panel to look at the particle size because I can have people with beautiful cholesterols, but when you look under the hood, it's
Mm.
oxidized. I run an LPLA2 and or an MPO, and those are myeloperoxidase, and
Mm.
those are ones that will tell you whether you actually do have atheromas that are going to cause a heart attack very soon.
Right,
Okay.
right,
So
right.
they're more specific. And so I look at the particles to adjust the particle sizes. And that has relatively little to do with using a statin. You could use B vitamins, you know, not, all different things.
Yeah, definitely. So, um, But at the same time, I have seen, this is interesting, Dr. Gengo. I have seen that statins do act a bit like an antioxidant.
Oh, they do.
That might be how they work, because I noticed when people were on statins that their ox-LDL did go down.
Oh, I'm not
But
saying they don't work, but at
yeah,
what
right.
cost?
But what's the cost? And what are the
Yeah.
other nutrients that it depletes? So I know it depletes CoQ10,
Yes.
and that's bad because although there's some studies that show it doesn't, and then it does, and then
No, it
I believe it
does.
does. I've seen
It
them.
does. Yeah.
And that's a like now you're stealing sort of like the sacred
Energy.
molecule from your body because CoQ10 is how all your mitochondria work and how your everything works with CoQ. I mean, it's the main thing that gives you every cell in your body energy. Here you and you're going to take
Exactly.
a drug that poisons that system. It's insanity.
Yeah. Well, it basically blocks it before we can make our own CoQ10.
Yeah, so you don't
So,
make any CoQ10.
so
I mean, what the heck is if people really understood biochemistry, they would really
mhm.
question this. But then, the doctor gets mad and they're paid to prescribe. This is interesting. So I'm on a board of a company, right? And actually, we have only a couple minutes before we have to take our break. So I'm on the board of a company, and one of the guys on the board is a well-known medical doctor, and he told me that they hold back 10% of his check if he does not prescribe statins for somebody with high cholesterol. And we were just we always we thought we were little
Well, that's
conspiracy
because
theorists saying that, but this was actually validation
yeah,
of that.
because that's most physicians are not private. They work for a corporation. So
Ah,
they're incentivized to do the standard of care, which is that's what the statin is to them, and then not to run tests, not to, so that's why when we talk about some of these blood tests, their doctors won't run it for them.
yeah,
You
that's
know,
a
so
shame.
that it's healthcare has changed. I've been in the business for a long, long time on both ends.
Right.
And,
That's out
you
on the
know,
allopathic end and on the
yeah,
naturopathic holistic end.
yeah.
Yeah.
And so it has changed for sure.
Yeah, yeah, yeah. Yeah.
So,
So we're going to go to our break, and when we get back, we're going to continue to explore heart disease and other manifestations of the cardiovascular system, and then talk about some solutions and our favorite treatments and herbs and nutrients for the heart and natural ways to lower your blood pressure and all kinds of great wisdom from our fantastic guest, Dr. Lisa Gengo. So stay with us, folks. Don't touch that dial right here at WPKM Bridgeport, the Natural House Call.